Price competition would correct the primary cause of the healthcare crisis, which is inflation and healthcare costs, by supplying the missing ingredient, price competition, that is not there now. It would also be necessary for healthcare suppliers to become more efficient so that they could offer a lower price and still maintain their profit margins. This would do a great deal to improve efficiency in the market in general. And suppliers would also have an incentive to develop more cost-effective options because the market would then exist for products and services that offered a better value. Not necessarily the most expensive, not necessarily the most effective, but ones that offered a better dollar value. That market would exist, and so research would be driven to find products that could be offered like that. So altogether, 3 of the 4 major factors in the healthcare crisis would be addressed through the development of price competition. Inflation and healthcare costs, waste and inefficiency would be much improved, and the cost of medical technology would be driven downward by introducing an incentive to choose more cost-effective products and services. Now let me skip over the cost of insurance and cost shifting and go to some of the other factors that are involved in the healthcare crisis, and then I'll come back to the insurance issue. Tort reform would also be addressed through this model because consumers would share the liability for their own healthcare choices since they help decide what product or service to buy. They would share some of the responsibility. That would limit damage awards and would go a long way towards improving the tort situation that is rather excessive under the present system. A financial incentive would also exist for patients to choose care responsibly, so consumption of expensive healthcare resources and heroic efforts to postpone death would diminish. And with this system of financial incentives, insurers could reward patients for making healthy lifestyle choices. In other words, they could offer them a cashback incentive if they were to lose weight, or if it could be proven that they quit smoking, or they had a good hemoglobin A1C if they were diabetic that shows long-term blood glucose control, that kind of thing, which would do as much as any insurance program could do to encourage healthy lifestyle choices. So far we've addressed all the problems in the healthcare crisis except one. Now to the cost of insurance and cost shifting. Insurance company reimbursements would be greatly reduced through the methods outlined in the Vernier model. These savings will be passed on to the consumer in the form of lower premiums and improved benefits. And we know this because insurance companies are our friends and can always be counted on to do the best thing for the consumer, right? Well, maybe not. Maybe what we need to do is to apply the same principles of price competition to the insurance companies that we do to the rest of the market. If we have robust price competition and accurate quality information, prices will be driven downward through price competition in the insurance market. If we use a part of this electronic database for the purchase of health insurance, and you can bring up all the different companies that could offer you insurance and all their different plans and how much they cost, and quality information about that company, like the rate of contested claims, et cetera, and most importantly, customer feedback. How happy are the customers with these insurance companies? And if you could, for example, under customer feedback, click on a link that gave you all the different comments about how happy or unhappy customers were with that particular insurance company, and you read 3 or 4 cases where the insurance company had rescinded their insurance now that they have terminal cancer because they, neglected to report the acne that they had when they were 15. I mean, nobody's going to buy that insurance. So it's important not only to have price information, but quality information in an easy-to-access database that allows for good comparisons. Now, if you eliminated the restrictions on the interstate sale of health insurance and made it illegal to discriminate based on pre-existing conditions, for example, then there would be many insurance companies that would be competing for a particular customer's business, and it would be impossible for them to engage in price fixing. Some company, some Geico-type company of health insurance would offer lower prices to attract more business, and prices would be driven downward. The savings generated in the larger market through price competition would be driven back to the consumer in the form of lower premiums and improved benefits. Now, health insurance is never going to become cheap. I mean, because healthcare is just expensive. Even if we enacted all these reforms, it would never become inexpensive. It would become a lot less expensive than it is now. There would always be room for the government to help the uninsured buy health insurance. But it wouldn't be necessary to create an entire bureaucracy like is being talked about currently. It would only be necessary for the government to help the poor, the disadvantaged, the uninsured, to buy health insurance from the lowest bidder that had an acceptable rating as far as quality information and customer feedback. This would further increase the pressure on the industry to lower prices, and if they had the type of insurance that I'm talking about with the incentives to choose the best value in healthcare, it would further add to the price competition in the larger market, which would further drive down prices. I think this would be a much superior method of addressing the healthcare crisis and providing insurance for the uninsured than what's being talked about now. Lower insurance premiums and improved benefits would result from the price competition, which would solve the last problem that we have, cost of insurance and cost shifting. Excuse me. Therefore, we've been able to address all the problems on our list of issues with the healthcare crisis, but most importantly, inflation and healthcare costs. All charge the same price. In order to have price competition, it would be necessary for them to have different fee schedules, and it would also be necessary to have other cardiologists be able to serve that patient in that hospital. That way they would have a wide variety of choices of cardiologists that had their own individual fees, and that would promote price competition. If you didn't have that, price competition would be impossible. You would have to eliminate the kickbacks from pharmaceutical companies to physicians because that they would have an incentive to prescribe products that were more expensive than necessary. A properly functioning free market depends on robust price competition, accurate information, a wide variety of choices, and transparent business practices, all of which can be obtained through the proper free market reforms that I've discussed.